So one of the most mystifying questions or the confusing questions in prosthodontics, one that is least understood by general practitioners and other specialists, is the semi-adjustable articulator. It looks like a very gimmicky toy that we prosthodontists like to play with. We speak in secret codes of side shift and bennett angle just to make it seem as though we want to frustrate you. It's the burning question. Do you guys really need a semi-adjustable articulator, and what does it do? To understand what a semi-adjustable articulator does, you first need to know what and how articulators are designed for. Now, this is a model of the human jaws, right? The maxilla and the mandible. Now, your mandible is capable of doing various movements. It can open and close. It can go side to side. It can protrude and it can retrude. Now, it is also capable of doing something known as a bennett side shift and a bennett movement, which we're not going to get into right now. But then, to put it short, these are all basically the movements that your mandible is capable of doing. And the movements, of course, have specific angles and different magnitudes depending on the person. Right? Each person has a very unique glenoid fossa and a condylar head shape. And these will determine what kind of movement that the person makes. If you look at a semi-adjustable articulator, right, you have certain values that are given. You can see a numbering from 0 to 60 here, a numbering from 0 to 30 here, right? So these are basically adjustments that are given to simulate the same movements of the mandible. By shifting these two angles here and here, I would be able to control the bennett angle the articulator would make when I'm moving the member from right to left. I would be able to adjust the condylar guidance, or basically how steep the mandible travels when it travels in protrusion in the glenoid fossa, by adjusting the angles here, and of course simulate that protrusive movement like so. Apart from this, of course, the semi-adjustable articulator also gives us the convenience of having magnetic mounting plates so that I can go ahead and mount multiple cases at the same time. It gives me an adjustable incisal pin, which would allow me to have a calibrated measurement of how much I open and close the bite, and I can basically change the patient's vertical dimension on the articulator. Of course, there is also the question of the face bow, which we'll not be getting into right now, and we will be seeing that in a separate video of how the face bow relates with your semi-adjustable articulator. Burning question: do you need a semi-adjustable articulator? The conveniences of having the plate and the incisal pin are nowadays available in a 3-point articulator. So no, for everyday prosthodontics, you do not need a semi-adjustable articulator. However, if you are doing complex work such as full mouth implant rehabilitation or a full mouth rehabilitation, there is tooth bone, then you would be better off if you were to incorporate the patient's individual condylar guidances and the movements of the mandible into the articulator and design your restoration so that the movements of the patient and of your restoration are in harmony. So see you guys next time.